Hello and welcome to the program. Lymphoedema is at worst a terrible affliction and at best can be a serious inconvenience to your life, but you can make it easier to live with. This video is intended as a guide to assist people in the self-care of their lymphoedema and provides general guidelines for this if you've been diagnosed. You should consult your doctor or lymphoedema therapist before commencing any self-treatment or exercise program. And if you experience any pain, distress or any other symptoms during or following the techniques shown on this video, you should stop immediately and consult your treating doctor. To understand lymphoedema, it helps to have some understanding of how the lymphatic system functions. The lymphatic system is closely associated with the blood circulation system, and both need to work together in order to keep us healthy. Blood is pumped by the heart to the lungs where it picks up oxygen. This oxygen-rich blood flows via the arteries to all parts of the body. As the blood flows through tiny vessels called capillaries, fluid containing oxygen and nutrients is released into the tissues. Any excess fluid is collected into the lymph capillaries, which carry away dead cells, excess proteins, special white blood cells, fats and debris. This fluid is called lymph. Lymph is transported by small lymphatic vessels, some of which lie just under the skin, into larger collecting vessels and then to a deeper system of lymphatic vessels and ducts, to finally empty fluid back into the venous or blood circulation. The largest collecting vessels are in the abdomen and chest, and they finally connect with the large veins at the base of your neck. The flow of lymph fluid from smaller vessels to larger vessels can be likened to a river which begins as a small creek, gradually flowing into larger streams, then in one direction only, finally reaching the sea. On its journey, lymph is filtered through many nodes throughout the body, such as in the groin, axilla, and the abdomen. The lymph nodes help to remove unwanted matter, assisting with bacterial and viral immunity in order to keep us healthy.
Lymphoedema is swelling which can affect any part of the body as a result of the failure of the lymph drainage from that part of the body. It is most commonly seen in the arms and the legs. The face, genitalia, abdomen and even the internal organs can be affected. Primary lymphoedema occurs when the lymph drainage system itself or its components are deficient or it fails to work properly. The main cause of secondary lymphoedema in Australia and New Zealand and other developed countries is cancer treatment, both surgery with the removal of lymph nodes and radiotherapy. Worldwide, the most common cause is certain infections such as filariasis. But anything that damages the lymph system, such as severe tissue injury, fractures, burns or infections, can undermine lymph drainage and cause lymphoedema. Obesity can be a contributing factor. Lymphoedema can affect anybody at any age. It can affect children as young as newborn babies right up to old age.
And then the process began of bandaging and diagnosing, and so from 4 days old she was in 5 days of bandaging and massage 3 times a day with the bandages off and on in between. So it was quite a journey we went on from there and trying to find some answers.
Lymphoedema is easily recognised in its most severe form, with stagnating lymph flow, chronic skin and underlying tissue changes occur. The skin thickens and cracks or bubbles up, and the skin below becomes solid, fibrotic and even woody. This is called elephantiasis. However, early forms of lymphoedema are often missed or ignored. Any persistent swelling for more than 3 months is likely in part to be due to failure of the lymph drainage from the area of swelling. Early diagnosis allows early treatment and ultimately a better outcome.
I think looking at my story, I was very fortunate that I was directed to get a good diagnosis, and having had the diagnosis, was directed to the best possible people to treat it very early. And this made a significant difference in my treatment. And I think that's what people have to be aware of. The sooner you treat this disease, the better the treatment outcomes are going to be. There's a lot of people that have been living with it for years and years with tissue damage and everything, and all that can happen then is manage it.
All people at individual risk of developing lymphedema would benefit from early diagnosis and early intervention.
A qualified lymphedema therapist can consider your symptoms such as swelling, discomfort or heaviness, examine your arm or leg to look for any scarring or joint movement issues, and assess size changes in your arm or leg using a tape measure and bioimpedance.
Bioimpedance is a clinical tool that your therapist may use that can help detect lymphedema before there are any visible signs of swelling.
There is no cure for lymphedema, however it can be controlled and managed well. For over 20 years, effective treatment called complex lymphedema therapy has been available in Australia. Best outcomes can be achieved with appropriate self-treatment and ongoing self-care. With professional help, your home self-care program will become part of your daily routine. There are 4 easy things to do each day: skincare, self-massage, exercises, and wearing your compression garments.
Simple skincare is important. It keeps the skin in good condition and protects against infection and the chronic skin changes that can occur with lymphedema. Good personal hygiene is also important. Time your skincare at the beginning or at the end of the day to fit in with your shower time or when changing clothes. As soap may dry your skin, you may want to use a soap substitute, aiming for a pH-neutral skin product. Take care when drying your skin, especially in creases, folds and between the fingers or toes. Fragile skin should be patted dry rather than rubbed. Use a non-perfumed moisturiser daily. If you are wearing a compression garment, allow the cream to absorb into your skin before putting on the garment. Inspect your skin daily for any signs of broken skin or redness. If you have lower limb lymphedema, you may need to seek the expertise of a podiatrist for cutting your toenails. Treat any foot and skin or nail conditions promptly. Try to prevent cuts or scratches, and if they occur, treat promptly by applying an antiseptic solution and dressing. Use an electric shaver while shaving to avoid cutting your skin. You can avoid insect bites by using insect repellents. Use a high-factor sunscreen to protect the swollen skin from sunburn. Avoid baths with hot water and hot saunas.
Because the lymphatic system is damaged, bacteria are not destroyed within the lymph nodes and remain in the swollen tissue. This can cause further tissue damage and is one of the main reasons why lymphedema can get worse. Bacteria can spread more easily in the blood system, causing septicemia, which is a life-threatening condition. Swollen skin can become dry and cracked. The small breaks in the skin can be the entry site for bacteria that can cause infection in the skin and the tissue beneath the skin. This infection is called cellulitis. Increased swelling, heat or redness of the skin can indicate the start of cellulitis. Sometimes cellulitis starts with a rash. Cellulitis can make you feel unwell, as if you're going down with the flu. You may feel feverish, start shivering or have muscular aches and pain.
I then developed, had 3 bouts of cellulitis, so infection became a real problem for me. I had a 4th one within the 12 months and the arm went backwards quite seriously then because the texture in the arm changed. Fluid gathered fairly easily. Whenever I exercised or was in heat, the fluid would also accumulate, so it became quite a difficult management prospect. The only way I could manage it was by coming to Mt Wilga and the girls doing treatments on it, or we'd do intensive 2-week periods on it. But At the same time, I developed a fairly comprehensive program myself at home. I swam because I couldn't any longer exercise by walking or running because the arm would blow up. The other things that I've done at home are I do self-massage, and I do that not every day, not religiously every day, because the swimming is a form of massage anyway. And I find the laser works very well with it as well. So I've maintained it pretty well. The infection has been my biggest issue by far. It sets me back every time. And I've been on prophylactic antibiotics for 12 months to manage that.
If you think you're developing cellulitis, you must see your GP immediately, as you will need antibiotic treatment. For those people with lymphedema who experience repeated bouts of cellulitis, preventative antibiotics may be advisable. Once you have started your antibiotic treatment, try to rest until you start to feel better. You will need to complete the full antibiotic course and may need to have a second course.
I think the single most important thing is to be vigilant, and to be vigilant particularly with infection. I'm very, very careful now about doing things, getting cuts on my hands, tiny little cuts there, where the infection must have got in, because there was nothing I really noticed that should have led to an infection, but it was there, and once it's in there it takes a long time to move.
For the purposes of this video, massage will be performed with our demonstrator wearing clothing for modesty. In the privacy of your own home, massage should be completed directly on your skin. Bras should be removed and underwear should be loose and comfortable. The self-massage demonstration shows basic techniques. You should consult your lymphedema therapist to see if this massage is appropriate for you. Massage is not recommended if you have cellulitis or a fever. If you have abdominal or genital swelling, you should contact a qualified lymphedema therapist. The massage is quite easy. It is soft and light, done with relaxed hands moving slowly over the skin, complementing the slow rhythm of the lymph vessels. There are two main techniques: circular massage and stroking. Circular massage is used over the healthy lymph nodes. Using the flat of your hand, move in a slow circular motion. This will stimulate the nodes in readiness to accept more fluid. 5 repetitions are sufficient, but they can be repeated again during your massage. Stroking is done to move lymph towards these nodes. With a relaxed hand to conform to the contours of the body, apply sufficient gentle pressure to move the skin. It should feel comfortable and not cause the skin to become red. Your massage needs to fit easily into your day, and it can be done at any time of day. About 15 to 20 minutes of self-massage is sufficient. Your massage can be completed with decongestive exercises. These exercises will be covered in more detail in the exercise component of this video. In this section, we're going to look at self-massage for the arm and upper body. To improve lymphatic flow, the fluid is drained away from the swollen area toward a healthy, functioning area of the lymphatic system by a specific massage. The massage will stimulate the important lymph nodes and collecting vessels along the pathway towards the armpit on the unaffected side, and also the groin on the same side as your swollen arm. The important nodes are in the neck, armpit, abdomen, groin, and inside part of your elbow. First, take 5 deep breaths. Place your hand on your abdomen just below the rib cage. As you breathe in, feel your hands rise. As you breathe out, give a little overpressure. Repeat this 5 times. Next, add arm movement. Slowly lift your arms upwards as you inhale. Relax your arms downwards as you exhale. Combining movement along with deep breathing will encourage lymph flow through the nodes in the neck, armpit, elbow, and those deep within the abdomen. Begin the massage by moving your hands to either side of your neck, just below your ears. You may use the flat of your fingers or the back of your hand. Ensure that you do not press too firmly on your neck. Gently stroke downwards from behind your ear towards your collarbone. Do this slowly 5 times. Now it is time to massage your chest. Begin by clearing the nodes in the armpit on the opposite side. Use circular massage with the flat of your hand moving slowly in a circular direction. This will help to stimulate these nodes in readiness to accept more lymph, which will be directed towards this armpit. Next, staying on the unaffected side, begin massage strokes from the chest bone above the breast, moving towards the unaffected armpit. Now you will need to move over to the affected side. This is the exit for the drainage pathway from the opposite side. You may have breast or trunk swelling. If this is the case, some gentle circular strokes will soften this blocked area to enable more effective drainage. You can use one hand or both to move lymph to the unaffected side. If you have a lot of chest swelling, repeat this sequence again, moving downwards to cover more of the chest area. Pay special attention to where you feel more swelling. Then return to the normal side and repeat massage over the lymph nodes in your armpit. Next, we will show you an alternative drainage route down to the groin. To massage the nodes in the lower pelvis, place your hands above the pelvic bones. To empty the nodes in the groin, place your hands in the triangle area at the inside top of the leg. Repeat the circular massage strokes here 5 times. These nodes will then be able to accept the extra fluid that is being redirected to them. Then begin to massage from the waist down towards the groin, stroking slowly 5 times. This will open more lymph pathways to move more fluid. Once you have cleared the lower abdomen, sweep from the affected armpit, making longer strokes to finish at the groin. Remember to go around any scar. After clearing your trunk, you can then begin to massage your arm. Massage from the top of the shoulder over towards the back of the shoulder. You can also direct the fluid across to the opposite side of your chest or down to the groin. Progressively move down the arm. Gently soften any localised areas of swelling with soft circular strokes. Massage does not need to be done in a lying position. You can also do this sitting up. If you are in a hurry, you can even do this in the shower.
It's great to have a partner or friend willing to help with your massage, especially for those hard-to-reach places such as your back and buttocks. If you do not have a friend to help you, you can use a body brush with a long handle.
First, you or your partner can clear the lymph nodes in the normal armpit. Try to do this 5 times. Remember to say if the massage is too firm. Then your partner can massage your upper back towards the unaffected armpit, gently moving the skin. Next, move just over the midline of the back, making a longer stroke to finish as before in the armpit. Then your helper will be able to empty the upper area of your back by stroking across to the unaffected armpit. If you have a very swollen area on your back or side of the trunk, a little extra attention may be needed. If this is the case, you can position yourself on your side, lying with your arms supported on pillows. This then allows your partner or carer to massage fluid out of the upper arm to either flow across your back to the opposite side or take the alternate route down to the groin. Finish each session by either taking a few deep breaths or just relaxing.
I had through this whole period needed lymphatic drainage massage. I was very, very fortunate. I have two close friends and they have massaged me. One of them has massaged me every second day as much as she could, and the other one would take over when that wasn't possible. And this process has really helped me through.
Sometimes it's easier to use a skin brush instead of your hands. Choose one that is soft. These brushes are available from large pharmacies. Use the brush to stroke the skin so that it works in the same way as hand massage. It should not cause redness or chafing of the skin.
I think I underestimated originally the importance of self-massage. I was very lucky in that I had a partner who would do it for me, but you can't continually ask other people again to do it for you all the time.
Compression garments are another essential part of lymphedema treatment. You should consult your qualified lymphedema therapist for prescription of compression garments, such as your stocking or sleeve, as your own medical history needs to be taken into consideration. If your garment is too loose, it will not work effectively. New prescription should occur every 6 months. However, your garments may need replacing more frequently if you lead a more active lifestyle or if you are overweight. There are many different brands and types of garments available. As well as sleeves, gloves and stockings, there are also special garments such as toe caps for swollen toes and garments to help control genital or breast edema. There are also garments that can assist with softening firm areas of tissue. The concept of wearing garments can cause some patients some concern. It may take you a little while to get used to your garments.
As far as putting the garment on each morning, I get out of bed, I have my shower, I have a cup of tea and I walk around, sniff the air outside and then go and get dressed, and then the garment goes on, and of course socks and shoes. But wouldn't be 30 minutes after I get out of bed that the garment's on my leg. I really don't like walking around without it now. I just hate to ever see the ankle go back to what it used to be like. So I don't have a problem with it. It goes on quite easily. It was a bit of a struggle at first. There's been a few bad words spoken and snagged nails, but the pink rubber gloves are the real go for getting it up.
It is best to put your garment on first thing in the morning after your shower when your swelling is minimised.
It is a great discomfort to wear the garments, to put them on every morning, to have your legs and body moisturised, but you get used to it because you know it's going to help you in the long run. So every morning I know I get up extra half hour earlier, I have a shower, moisturise my legs, wait for the moisturiser to dry off a bit, then I put my garments on, and then I put my bodysuit on, and I'm ready for the day. And I seem to just got over that initial shock of putting the garments and wearing them, and I feel that it's a positive. Now it's a part of my life every day. It's like having a cup of coffee every morning.
Use a rubber glove to put on your sleeve or stocking to protect the garment and your skin and to help smooth out any wrinkles. You may or may not need to sleep in your garment at night. This needs to be discussed with your treating therapist. Do not double over the garment at the ends, as this may cause a tight band, which will make the swelling worse. Garments must fit comfortably. If you feel pain, pins and needles or numbness, take it off and ask for advice from your therapist. There are a few aids that can assist with applying and removing your garment. Likewise, a particular style of garment, such as one with zippers, may be appropriate for ease of application. Please discuss these options with your treating therapist. Care for your garments by following your garment manufacturer's instructions. Your clothing should fit comfortably with no tight elastic straps or bands that may interrupt lymph flow at the shoulder or trunk. Protective clothing will help prevent damage to your garments, such as household or gardening gloves and shoes. For your general good health and well-being, regular exercise should be an important part of your daily routine and is a critical part of controlling lymphedema.
Exercise is recommended for the efficient and ongoing self-care of your lymphedema. When we exercise, our muscles contract and relax to create what is known as a muscle pump. This muscle pump helps to move excess lymphatic fluid from the arm or leg to the trunk, where our bodies can then eliminate it.
Exercise is also recommended for weight management. Research has shown that being overweight or obese can worsen the severity of lymphedema symptoms and limit the benefits of compression garmenting. Exercise also protects against chronic diseases and promotes many extra health benefits such as improved mood, increased bone density and heart health. The use of exercise in combination with compression garments is considered to have an added effect on lymph flow. If you have been prescribed a garment, it is recommended that you wear it when exercising. Exercise intensity should be progressed gradually and slowly with guidance from your treating lymphedema therapist or exercise physiologist.
This is about functional exercise. We all exercise our muscles in different ways by moving around and carrying out our day-to-day activities. This functional exercise doesn't have to be completed in a gymnasium. You can exercise by taking part in activities such as walking, bike riding and swimming.
When I say being proactive, I think that's what I regard swimming as, being something that keeps the arm fit, it keeps the fluid moving in the arm and it keeps the muscles turned so that they'll pump the fluid out of the arm.
Even tasks such as hanging the clothes out on the line, vacuuming and cleaning can be considered as exercise. Remember to maintain good back and shoulder posture when completing all tasks. Specific lymphatic exercises include decongestive exercises, cardiovascular exercise, stretches, and resistance training. Decongestive exercises form the warm-up component of your exercise session and encourage draining of the groin and underarm lymph nodes and larger abdominal vessels. These exercises assist with the flow of lymph and prepare the working muscles, cardiorespiratory and lymphatic system for the workout ahead. Deep breathing can help the deep lymph system to work better. The diaphragm is a large sheet of muscle which stretches across the body between your chest and abdomen. As you breathe, the pressures change inside the chest, and this helps the deep lymphatic system to work better. This will in turn help the lymph drain out of the limbs. Breathing exercises can be done any time and should be done at the beginning and at the end of your self-massage and exercise routine. You can incorporate your breathing exercises with your general exercise regime. Other forms of exercise that encourage deep breathing and limb movement, such as Tai Chi, can be very beneficial. Stand upright and look straight ahead. With arms relaxed by your side, gently roll your shoulders forwards in a slow and controlled manner. Maintain normal breathing. Once you have completed forward shoulder rolls, repeat this exercise in a backwards direction. Stand upright and look straight ahead. Raise arms outwards to the side in an alternating manner. Movement should be slow and controlled. You are aiming on deep breathing throughout the exercise and with the arm movement gently stretching and opening up through the sides of your trunk. If your shoulder movement is restricted, start with small arm raises and gradually increase as movement improves. Lie on your back with your knees bent and feet flat. Take a big breath in, and as you inhale, bring your knee towards your chest. As you exhale, slowly lower your leg back down. This can also be done in a sitting and standing position. Set your posture when standing. March on the spot with high knees. If able, swing your arms as if walking.
Stretches should be felt in the muscle and surrounding tissues, but should never be painful. Body position is important for an effective stretch, and best results are achieved by stretching gently for 15 to 20 seconds. Stand with your forearm resting against the frame. Your elbow should be level with your shoulder. Ensure your shoulder is relaxed and not raised. Gently lean forward with your trunk until a gentle stretch is felt through the front of your shoulder and chest. For a less intensive stretch, perform this exercise with a straight arm held low on the frame. Stand upright and look straight ahead. With your arms by your side, gently tilt your head to each side, ensuring the shoulders remain relaxed.
Cardiovascular exercise includes activities such as walking, swimming, cycling, jogging or aerobics that are designed to make you huff and puff so as to improve the efficiency of your heart and lungs.
Aerobic exercise also increases pressure in the abdomen, which encourages lymphatic draining. Your muscle pump will also be utilised. Walking is a great way to boost your fitness as it is easily accessible to everyone, doesn't require fancy machines, and your only cost is a pair of good walking shoes. Try to walk at a brisk pace each day. Walking should be done during the cooler periods of the day to avoid overheating. Higher intensity exercise may be suitable if you are accustomed to it and your lymphedema is well controlled. Other examples of exercising for fitness is hydrotherapy. Your therapist can prescribe a customised program for you. If you have joint problems, hydrotherapy removes the weight of your body off your joints, so you may be able to complete exercises easier in the pool than you can on land. Pool activities are also a great way of encouraging exercise as it can be fun.
I developed a fairly comprehensive program myself at home. I swam because I couldn't any longer exercise by walking or running because the arm would blow up. So swimming became my best friend really, and I found swimming fantastic for it. It always moves the fluid out of the body, keeps the muscles fit. So I swim 3 times a week.
Strength training involves moving your body or body part against a load or resistance. This could include using your body weight, free weights or therabands. Stand half a metre from the wall, with hands placed on the wall at shoulder height. Keeping your body rigid, bend your elbows and bring your nose close to the wall before pushing back to your original position. Correct body positioning and symmetrical arm movement is important when performing this exercise. Sit upright on the edge of a chair. Loop your TheraBand around a rail or door handle and hold each end. Keeping shoulders down, pull elbows backwards and gently squeeze shoulder blades together. Hold for a moment, then return to your original position. Correct posture is important when performing this exercise. TheraBand is inexpensive and can be purchased from your local physiotherapist, exercise physiologist or sporting retailers. Holding your light dumbbells, stand upright with arms relaxed by your side. Bend both elbows and raise weights towards your shoulders. Lower slowly. Light tins of food can be used if you don't own dumbbells. To conclude your exercise session, repeat your deep breathing exercises and do gentle arm exercises such as grip squeezes. Seated or standing with good posture with elbows by your side, squeeze a stress ball or rolled up face washer in your hand. Hold for 3 seconds, then relax.
So if you're not doing enough exercise, hopefully these suggestions will help you to become more engaged.
Lymphedema is a tough thing to live with. It certainly changes your life and also often that of those who love and support you. There's some amazing people, patients and carers, who have contributed to this program. And what follows is a few closing comments from them. For full versions of each of their interviews, look for their stories on the DVD or on the website.
There is a great deal that you can do on your own as part of your ongoing health maintenance to successfully care for your lymphedema.
The message that I'd convey to anyone who has lymphedema is don't let it take charge of your life. You are free. You can manage things, you can do exercise, you can look after yourself, and you can enlist all those close people who want to help you.
So I guess that'd be my advice. Vigilance with infection, exercise, proactive and massaging. And get on with your life. I mean, we've got over cancer, so this one's just a management issue.
My advice for other people who are suffering from lymphedema, and it doesn't matter how young or old you are or how big or small you are, you need to have treatment. It'd be to speak to a specialist and someone who knows about that actual disease, and you need to get it treated straight away because it can only affect you ongoing non-stop, so you need to get specialist help straight away. I got specialist help and it's helped me immensely. It's turned my life around.
A lot of them don't realise that when you first get diagnosed that this isn't going to go away in a hurry, and you have to sort of set up your life to incorporate the lymphedema and not ignore it, otherwise you don't go for the treatment and it'll get worse.
If you're diagnosed with lymphedema, my recommendation is that you get active and do something about it as soon as you can.
My advice would be always to have your treatments. Keep it up. Don't think that you've had one, you'll miss a year and you'll come back the next year. I always find that it keeps it well maintained and well controlled to continue your complex therapies. It's very important to me because it keeps me mobile. I would say that. I find when I talk to lots of people, they say, oh well, it's such a long way to come, or finding time, but really it's something you have to set time aside for.
I guess just, for anybody else out there going through what we're going through, is just don't be afraid to admit defeat. Don't be afraid to say, I'm not coping. And I got postnatal depression with Misha just because it all just became way too much and I just couldn't cope. And so, it's just a part of life, and just don't be embarrassed about it. There's people out there that want to help and do care for you that, don't be afraid.
Thank you to all those who have so honestly shared their inspirational stories, their challenges and successes with their treatment and self-care. It's hoped that this video will also assist you to not only live well with your lymphedema, but to thrive into the future.